Well, there's lots of interest in different things right now. We've got, I would say that you're absolutely right that psychotherapy is the foundation for eating disorder treatment right now yet. Obviously, psychotherapy doesn't work very well with a malnourished individual. So if you've got individuals that are low body weight, and it's important to know that people not even at low body weight, at normal and above normal body weights can be malnourished, that their brains aren't functioning properly. You have to set the stage for proper recovery by getting them back to nutritional health. So then you can do the psychotherapy piece, and if there was one therapy that you could choose at this time, it still probably is cognitive behavioral therapy. That's been the mainstay in our country for eating disorder treatment for a long time, and there's even developing some new variations on cognitive behavioral therapy that are more specifically tied into eating disorder treatment. But there's also other psychotherapy tools that you can use with ACT, with DBT, dialectical behavior therapy, and other techniques that have come out that help with the emotional regulation involved that's so needed with these kinds of illnesses, with the various fears and things involved with that. On the other hand, there's a lot of interest in medications as well right now. And when we look at eating disorders, we know that it's not just a disorder of thought processes. There's a relationship to the brain chemicals, norepinephrine, serotonin, dopamine, that these chemicals are out of balance. And how do you help these individuals get into better balance? Are they genetically born with some type of imbalance in their brain chemicals that predispose them towards eating disorders? Can you influence better balance of these brain chemicals? Well, certainly you can through nutrition, and we do that, but do they go completely back to normal? Not in everybody. So does that predispose them then to retrenchment and getting back into their eating disorder? Likely so. So once an individual has the substrates for the chemicals through the improved nutrition, now we can utilize the medications to try and influence that balance a little bit as well. And I've been treating eating disorders for 22 years now, exclusively working on the medical side of eating disorders. And I've seen a huge evolution of the change in medications that are used to treat these individuals. Because the early medications that we had, unfortunately, we're fraught with a lot of side effects. And now we have medications that we can use to take care of the anxiety, to take care of the obsessive compulsiveness, to even treat some of the pseudopsychotic features of eating disorders with atypical antipsychotic medications that are much better tolerated and very, very helpful given the right circumstances.